Hello, everyone, and welcome to episode 2 of the new podcast conversation series here on One Mission DMD. In this new series, I'll be sitting down with pre-dental students, current dental students, and dentists currently working in the field, trying to answer your questions as well as mine for all things dentistry. So if that's something you think that you can benefit from, please subscribe to the channel and like this video for future content. Also, just so you can have an idea as to what topics were covered in this episode, go ahead and check out the video description of this video here, and in there you'll see timestamps for all the questions that were addressed. So go ahead and just click wherever you want on there to get to that point of the video, and you'll be able to get to it. Without further ado, here's our conversation for today's episode with pre-dental student Priya Vaid from Rutgers University in New Jersey. Hello, Priya, and welcome to the One Mission DMD podcast conversation series. How you doing?
Hi, Teham. It's going well. I hope things are going well on your end as well. Thank you for having me on your channel to share my pre-dental journey.
Yeah, everything's going well. No problem. Glad to have you here. So, tell us about yourself and where you are currently in your pre-dental journey.
Of course. So I'm a fourth-year pre-dental student at Rutgers University. I'm double majoring in genetics and in public health. In terms of my pre-dental journey, I decided to pursue a career in the dental field at the start of my junior year. And I have completed the core courses to go in that are required for dental school. I haven't yet taken my DAT because it got canceled, but I do plan to take it prior to my next semester, and I'll be applying to dental school this coming cycle and will be taking a gap year.
That's awesome. So, the fact that you already took your prereqs means that you pretty much just have a lot of the genetic stuff left, right?
Right, yeah, a lot of upper level science electives, things like that.
Gotcha. So that's awesome because even though your prereqs are done, you'll still be able to potentially keep padding up that science GPA even more because of all your major classes, right?
Yeah.
Okay, that's
Yeah.
awesome. Okay, cool. So I actually took a gap year too. So have you talked to people that have taken a gap year? Like, what have you kind of come across regarding gap years? What do you know so far about them?
So I've come across a lot of dentists who haven't taken a gap year, and it's been a little difficult trying to get how I could, go along with my pre-dental journey. But as far as what I've heard in terms of gap years, I know that a lot of students consider working. Some of them also do like post-bac programs, master's programs. So it kind of just differs based off of, each person's journey. But I was just curious to know how your how your gap year was and what made you decide that you wanted to take a gap year.
Yeah, so I started undergrad in 2012. Sounds like forever ago. But yeah, I graduated in December of 2016. So I took 4.5 years. So I was a business major and I did pre-dental with it, right?
Right.
So when I graduated, I knew that my GPA wasn't where it needs to be for applying to dental schools because I looked at the DIA guide to dental school and I kind of knew that I had to pad it up a little bit and improve myself. So that's why I decided to do a post-bac. So I went back to my undergrad like the month right after that in January, and I enrolled in some classes that I just decided to retake. Like I took Orgo 1 again. I took Bio 1 again as well because it was nearing the 4.5, 5 year mark. And I know a lot of schools require it to be within 5 years. And then with those classes, I also took physics for the first time because I just prolonged physics for some reason. I just hated it. And what else? Oh, I took endocrinology and some human phys classes. So I was just involved in taking classes back at my undergrad. It wasn't like an official post-bachelorate program. I just went back to my undergrad and took some classes that I knew I needed to do. And you also mentioned working. I did that too. All throughout undergrad, I was a dental assistant. But for some reason, I got hit up with a family friend of mine that needed scribes in his hospital.
Cool.
So randomly, I decided to just start scribing that year while I was taking those classes. And it actually worked out because if I'd be working nights, then I could have a day of rest and then go to school in the morning then 2 days after that because I was going to school twice a week. So I was able to fit my schedule a little bit there better. But I did also decide to enroll in a master's after the post-bac because during undergrad I applied once. Before I graduated, I didn't get in, right? So, with the post-bac
Okay.
classes and my working experience, I decided to go do that master's just to kind of, put the cherry on top. I really wanted to make sure I get in my second time. And after I submitted my grades during my second application cycle, I found out a month after about responses from schools. So that's kind of how it shaped out for me.
That's nice. It's cool to know that even though, you worked as a scribe, so you had a different experience in the healthcare
Yeah.
field. I know a lot of students think that to get into dental school, they might need to start working as a dental assistant, but I don't think that's necessarily the case.
Yeah, for sure. It's not essential. I can say that for sure, yeah.
You definitely learn a lot of different skills and different work areas, so
hmm
I don't think that it's the make it or break it type of
Oh,
thing.
this just reminded me actually. So, in the ER where I was scribing, I remember a lot of patients would come in with dental pain, right?
Right.
And the only thing the ER physicians would be, able to do is give them antibiotics and pain medication.
Yeah.
And then at the end of the visit, they'd tell them, "Hey, go to the dentist," right?
Yeah.
And I remember in like the system, it's called Epic. That's the system that hospitals use to input like charting and paperwork and stuff.
Right.
And in there, there's a head and neck section, and then there's teeth. And in their program it says which tooth, 1 through 32, right?
Right.
And the docs were asking me because they knew I was a dentist. Oh, what tooth were they talking about? I'm like, oh yeah, it's that tooth. So it was pretty funny. It's pretty cool how like both were like merging together, medicine and dentistry, and like both the practitioners have to interprofessionally at times communicate with each other too. So it's all very related.
Yeah, I've also come across a lot of patients that complain of teeth pain or like anything related to like their oral area, and sometimes they just get medications and they're sent back home or referred to like a dentist. And I guess, yeah,
I think the next topic we're going to talk about is what enabled us to decide to pursue the career of
yes,
dentistry. So, if you want to maybe just share a little bit of that.
sure. So I came into Rutgers knowing that I wanted to pursue a career in the healthcare field. However, I decided upon dentistry after a lot of self reflection on my own part. I shadowed and volunteered at a lot of healthcare facilities to not only understand how patient care was established in those areas, but also to see if I saw myself there 10 years down the road. And ultimately, I decided on dentistry because I understand that there's a lot of disparities in regard to dental healthcare access, and I kind of want to work on bridging that when I grow older and work as a dentist.
So, like, what part of your undergrad did you decide, though, that you knew early on that you wanted to pursue it?
So I think this would be like the very start of my junior year, so September of my junior year. Yeah.
Okay,
I talked to a
gotcha.
couple of my friends to see who were pre-dental to see like what they were thinking. I mean, it was easy because I already took the prereqs anyway. But I spoke to a lot of my friends to see like how their pre-dental journey was and what they would change and, learn from their experiences.
It's always good to talk to people that you can really just bounce off ideas from and kind of get some insight. That's great. So my decision was actually around junior year too. I've talked to a good amount of people and they all say so there's only two. Usually it was in freshman year I knew or I made the decision in junior year. So that's kind of what happened with me too. Junior year, my dad is a pharmacist, so like I had some idea about pharmacy and we have a lot of physicians
Mhm.
within our social circle back in like Houston where I'm from. I didn't really have that much exposure to dentistry, honestly. I really didn't. There was a pre-dental club at my school and they had this Mission of Mercy event. And that was where I decided to, let me just get my feet wet and see what dentistry is about and I volunteered. And from that day, like I knew that I loved it a lot. And so yeah, I picked it from that day
Right.
and I knew that I just wanted to do it. So I've never looked back ever since, and here we are. So with the undergrad experience and everything that goes into it, a lot of schools really like students that are, well-rounded and involved with, programs, clubs, and extracurricular activities. So what kind of stuff were you
So
involved
in
in while
terms
you
of
were an undergrad?
extracurriculars, I was involved with a few major organizations through undergrad that I have now become very passionate about. For instance, I currently am the campus chairperson of New Jersey Global Brigades. So, Global Brigades is a student based organization that leads medical and dental missions. Well, the ones that I specifically led were medical and dental to indigenous and refugee communities abroad. So, that was one aspect that kind of solidified that yes, I want to work in healthcare and I want to be able to give back to the community, especially considering that there's so many people who lack basic healthcare amenities. And then in terms of like the pre-dental society in my school, I'm one of the bigs, um, and I'm just, I guess what sets me apart in terms of like my journey is just like how I decided upon dentistry, and maybe that isn't the case for most pre-dental students who are determined pre-dental, like their freshman
Hmm.
year.
That's cool. That's really cool. Like it's a very outreach type of a organization, right?
Yes.
Okay, that's really good. And I'm hoping that you probably will also be mentioning that in your application, like in every category of activities you're involved in, just explain that, and it's going to be really cool. And especially if you pair that with like some type of faculty that's involved with the organization, like a professor or just like a sponsor for the organization,
Yeah.
whatever it may be. If they can just corroborate what it is that you're involved in, that would really
Right.
go well with it, I think, for a letter of recommendation. What's important to take away from it is when people look at extracurricular activities, they're like, okay, if I'm pre med, I have to be in pre med groups. If I'm pre optometry, I have to be in pre optometry groups, whatever. But that's amazing to do that. But there's no like actual set in stone rule that schools look at, like, okay, were you president of the dental club or no? What were it's not as clear cut like that. So basically what I'm saying is it doesn't matter what you're involved in as long as you have a passion for
Yeah.
whatever it is you're involved in. That's the most important thing. So like I was involved in like some Muslim student association campus groups. I was involved in another outreach one.
That's
It was
cool.
called UMR, United Muslim Relief, stuff like that. Just like whatever you have a passion for, as long as you're involved in it in some fashion, like that's exactly what you need to do. And
Mhm.
hopefully, just also keep track of the hours for it. And that leads me into the importance of being involved in the community. So, is there any current like relief work or community service that you're involved in as well outside of school?
The relief work that I'm involved with is with Central Jersey Diaper Bank. So this diaper bank basically provides uh, infant necessities or like necessities for developing children. And given the pandemic, a lot of people can't afford those items to take care of their kids. So we work with Central Jersey Diaper Bank to give those amenities to people in need.
That's cool. So you're pretty much involved in a little bit of everything, so that's good. The reason I brought it up is because depending on what schools you apply to, some will also ask for your community service hours. So yeah, and some schools actually require a certain amount.
Okay.
So my school, it's pretty community service oriented, like even the entire dental school and how it operates.
Right.
So they required like I think a certain amount of hours. I'm kind of forgetting how much it was, but that's something that if you know that you want to apply to a school that requires that, you might want to make sure you're also documenting those.
Okay, that makes sense. So like when
Hmm.
we're applying, we just put those in ourselves, correct? The hours that we
Yeah, so you can do it in two places. You can do it in the main AdSAS application.
okay.
So that's the main website you use for applying to every dental school in the country.
Right.
So it's like a main portal that any dental school will see that information. But let's say that you're applying to a school that does require specific community service hours, you can contact the school individually and be like, hey, did you want me to put it in the main AdSAS application? Do you guys want me to send it to you directly? So that's kind of how that would go down, and you can just do whatever the school asks you to do.
Okay, that makes sense. Yeah.
Okay, so just to go into some more detail regarding the gap year, I think you did have some more questions and we can address them now. So you said, what criteria should students be looking for when choosing master's programs for a gap year? So some criteria you can really use to help yourself. I think I spoke about this before. Pretty much using the IDEA Guide to Dental School. That's probably the
Right.
best criteria you could use because all 60 plus schools are documented in that book. Every school. and they give you the details in terms of what DAT score ranges they accept students, what GPA ranges they accept students, like the in-state, out-of-state acceptance rates for each school because they're all different. So
Right. Right.
you got to take a look at the book. I would highly recommend that so you can get a better idea in terms of where you are as an applicant, and if you feel like if you're a good candidate for a potential interview, or if you feel like you need to work on things. So that's the best criteria. I mean, what I would definitely say, and I spoke about this in the previous video, that 3.5 GPA. If you're 3.5 and above, that's great.
Yeah.
Like, you have a really good shot at being a competitive applicant with a good DET. So if you are now nearing the 3 and below range, then you might want to maybe consider a master's, potentially, not absolutely,
Okay.
because I know students that had a 3.3, slightly below, but not insanely below, with a great DAT and they got in.
Hmm.
So it just depends. So, like, if someone's kind of nearing the 3.1 range, 3.0 range, then I would maybe talk to the person and be like, hey, maybe you should consider a master's. And the programs that you guys should be looking into are the ones that have statistics, because there's so many pre-dental, pre-medical master's programs out there, and there are literally new ones every year that are like
Right.
popping up. So you want to look at the ones that have the statistics of the students that do the program with them. Like, how many of them are getting into dental school, right? Medical school, whatever. That's what's important for anyone to know.
Right.
So when I was applying, I applied to like 6 or 7, I think. Only one of them gave me like official statistics about
Right.
their students that got into dental school, and that was at Case Western in Ohio. So that's the only reason I went there. I could have gone to I could have gone to Arizona. There was one I got into here in Midwestern. I got into one in Tennessee. So that's why I picked it. That was a criteria. I knew my GPA
Yeah.
was getting better after my post-bac. I took it to a 3.3. And then I knew I wanted to just look like a better applicant and present like more upper level coursework. So that's why I picked the master's. But again, it's definitely not for everyone.
Yeah. And I don't think that people should think that they'll have to take masters to get into dental school,
Hmm.
because I'm sure there's a lot of other aspects that'll allow them to get accepted, or yeah.
Yeah, exactly. You're right on the money there. And some people they think that, I mean, it depends really on the
Yeah.
person. Like, everyone's GPA is going to be different. If they're like having a 2.0 GPA or a 2.5 GPA, and even if they take post-bac classes for a year or two, it's not going to improve insanely. Like, I would still recommend people in that boat to still take post-bac classes, because if they take it to a 3 or a 3.1 or whatever the case may be, and then if they pair it with the masters that they do really well, and then that could be good. But if you left that GPA at that sub 3 range and you did masters, like, it'll still be troubling and alarming for them, you
Yeah.
know?
So I'm curious, your GPA in your master's program, does that get totaled with your GPA from undergrad, or is it different?
That that's a great question. So both GPAs are looked at
Okay.
individually, because a master's GPA they won't combine a master's GPA with an undergraduate
Right.
GPA and average it. They're not going to do that. What they're going to do is they'll look at your master's one and your undergrad one separately.
Okay.
So that's how it would
So your
work.
post-bac one.
So your post-bac one is actually, believe it or not, getting factored into your
Okay, that makes
undergraduate
sense.
GPA. So yeah, they can see what you graduated with, and then they can see separately the GPA for the post-bac. Like, if you got 4 A's, you got a 4.0 in the post-bac, but then that gets averaged into
Mm.
your cumulative GPA for
Okay.
undergrad. But the same does not happen for the masters. That's like an independent stack of grades.
Okay, makes sense. Okay, so would you recommend for those who are interested in pursuing a master's that they pursue a master's in a school that offers like a pre-dental program, or do you think that masters have to be solely science-based?
I would say for sure for them to be solely science based. So I know one, for example, is Texas A&M in it's like just outside of Dallas in Fort Worth. They have a dental school, and they do have a pre-dental post-bachelorate program. It's like an official post-bac that's done through the dental school's
Right.
like upper level science programs. And yeah, that's something you can definitely do. I'm not sure if Rutgers has one, but if they do, yeah, you could definitely look into it. But bear in mind that those programs, it's a really great thing to do if you're very adamant about going to that
Right.
specific school's dental program. I'm not saying you're not going to get into dental schools outside of that school if you do the program. I'm just saying that there might not be as many statistics and known information about the students that do the program that don't get
Mm.
into that program's dental school. Does that make sense? So yeah, that's the
Right.
only reason
Yeah,
I
that makes
decided to
sense.
pick and apply to like big schools that like had a well described and understood program like that was a master's. I just wanted to increase my odds, you know. Like I applied once and I didn't get in. I really just wanted to do whatever would help me the most. So I'm not saying don't do
Yeah.
that. I'm just saying do whatever you think is sufficient enough for
Right.
you to be a good
And I
applicant.
think it will be
That's what I would
pretty
say.
helpful if you have statistics from a school in regard to how many students got into dental school, and that'll be easier for you to make a decision on which program is
Yeah,
better for you.
exactly. 100%. Yep. And then I also get questions from people that are finishing undergrad or about to, and they're like, "Hey, is it okay if I do an MBA? Is it okay if I do a MPH, a Master's in Public Health?" I'm not
Yeah.
gonna say no, but I will say like dental schools want to know how you'd perform in science classes, not in business classes, not in. I
Right.
mean, my school is very also public health oriented. Like everybody at my school graduates with a certificate in a Master's of Public Health. So we have the choice to
Okay.
graduate with our dental degree and an MPH if we decide to further our education with an MPH with the
That's awesome.
dental stuff, right? Yeah,
Yeah.
it's pretty cool. But even if we decide not to do that, if we decide not to get a master's with our doctorate, we'll still get the certificate in the master's, allowing us to come back within a certain amount of time to do that if we want to.
I can read it.
Yeah, so the reason I bring that up is because then some people say, then I can just do an MPH. I'm like, yeah, you can, but that's not going to help you in all the schools you're applying to. It's only going to help you to a certain extent of the schools that you apply to. So, like my school, I know a student who's a senior right now did an MPH actually. She did an MPH and she got into this dental school. She told me that like she knew doing the MPH wouldn't help her in terms of every school she applies to, but she knew there was some. So that's why
Right.
I'm not gonna turn down anything, but I will say most schools overwhelmingly prefer the science-based ones.
Yeah, and I think it's super neat that your dental school offers the joint degree program with like a DDS, DMD,
Yeah,
and a MPH.
yeah, it's pretty
Yeah.
cool actually. It's really cool. I think it's the only one in the nation. I don't know if anyone else. I know there's some that do a law program. I think it's University of Pennsylvania that does that. They allow you to do a
Pretty
JD with
cool.
a DDS or DMD. That's pretty next level. I think those are most of the topics that you sent that we decided to talk about. Is there anything else that you came across while we were talking that you wanted to ask or anything like that?
I think a lot of people might be interested in understanding how they can get shadowing hours
Mm-hmm.
considering the whole pandemic,
Mm-hmm.
and maybe you could give some suggestions on that.
Yeah, for sure. So I've been following some Facebook pages. I think DAT Bootcamp and like some other smaller ones because Bootcamp has the most amount of members, as I think you may know. Um,
Yeah.
but there's some other ones. I think like it's called Competitive Dental Applicants on Facebook. I've noticed a lot of docs been posting on there and be like, hey, do you need virtual shadowing hours or something like that? Like they're posting on there
Okay.
for people if they need some hours or whatnot. But I mean, what you could do is you're in the Jersey area, right?
Yes.
You can like just contact some dental offices and be like, hey, I'm a pre-dental student. I know that it's COVID and stuff, but I was wondering if given the proper PPE protocol, like if you allow me
Right.
to just shadow you. Just I know it's going to be tough right now because of COVID, but
Right.
that's probably something within the application for every pre-dental student that is not going to be looking too good. I can tell you that
Right.
because, obviously dental practices want to limit the people that come in, right? So, I mean,
Yeah.
you could reach out to dental practices. I don't know if you have any dentists in the community, but
Yes.
just try to reach out to them and gauge from what their response is what you could do. Um,
Okay.
that's what I would
Sounds
say.
good.
Yeah, I know it's tough, man. Honestly, everyone with COVID right now is really struggling out there, pre-dental students. And I know you said
Yeah.
you had your DAT rescheduled because of that, right?
Yeah, a couple of times.
Yeah, that's just crazy. So, like, I know they give you like a 6 month window to take it. So, like, are they extending that
Yeah,
because of
they
these changes to
definitely
test?
extended mine over the 6 month window, and that's why I've been able to reschedule it for a later date. And I
Mhm.
just hope like another wave doesn't come, so I don't have to reschedule again.
Yeah, like I even heard some people are finding out that their test is canceled the day they get to the testing
Yeah,
center.
yeah,
That's just
that's
crazy. I don't know
unfortunate.
what I would do. Yeah, yeah, but I think that happened probably early on once the outbreak kind of reached here after spring break. But I don't think people are finding out the day of their test now, right? Like it's a
Yeah,
little bit more organized, I think.
I hope. I hope.
Okay, I hope so too, man.
Yeah,
Yeah, but that actually leads me into another point. Some pre-dental students were asking, "Hey, is this the year that like dental schools are gonna
mm,
waive the DAT?"
yeah,
Um, I don't mean to burst anyone's bubble, but I'm telling you for sure that I don't think anyone's gonna get into dental school the next cycle. I mean, the next class that hasn't taken the DAT. I'll be honest with you.
yeah. I
Um,
haven't heard much about them like waiving the DAT and stuff like that.
like there's hundreds of people on the DAT Bootcamp Facebook page that are like, "Oh yeah, this school's doing it. That school's doing it," but
Okay.
they're in the mindset that like, "Oh, I'll get into dental school without the DAT." That's not true.
But I feel like that would
Like,
make it a little bit harder because then you have to prove
yeah,
yourself in terms of your grades
exactly.
and I
Yeah,
guess like those are the only things that dental school can look at and it'll be a
yeah.
little difficult.
Right. And the reason why I think this is because, yeah, they might interview students prior to taking the DAT, but at the end of the day, they're only going to accept the ones that have the application completed. So like
Yeah,
out of 10 students they interviewed, that five of them didn't take the DAT. If they didn't take the DAT, if they had better stats, but they interviewed five prior ones that had everything completed, like
yeah,
they'll accept them. So it doesn't matter if you get the interview before or after the DAT. They'll make a decision for you for sure in your favor, most likely, if you have everything completed. And I know that the timeline of everything is kind of really funky because of COVID with cancellation of tests, but that's why they might extend the interview dates, because this is the first time that dental schools are having to go and do online interviews.
yeah,
So, they might extend the acceptance dates to like 2, 3 months prior to the school to start. They might do that. That even happened for me actually in my class.
okay,
We had students come into our class 2 weeks into our program, and that
wow,
was without COVID.
okay,
So, I'm sure that might happen even more so now. Like, who knows?
yeah. I think that might be the case. They might, um, I think dental schools might have to extend their deadlines or, maybe be a little more lenient with interview
Yeah.
dates and stuff like that, just so it's accommodating for everyone across the board.
Yeah. And I think for the most part, schools have been. But yeah, hopefully everything can work out for you. You said you're scheduled to take it in January, is that right?
Yes, I'm scheduled to take it in January.
Okay, and that's a good amount of time, January through June, before the application opens. That's
Yeah,
really good. So that'll give you time to focus on, all the other stuff like your personal statement, your
yeah,
letters of recommendation to contact professors. And that's even better because contacting the professors early on in the semester
right.
is way better than
Then
contacting
later,
because later what are they doing? They're putting in grades. They're putting in like they're
yeah,
talking to so many like administrative people in the school and they're just so busy. So that's a good thing for you. And even if you have to feel like you need to extend your test after January, it still doesn't matter because you have so much time before the application opens, right?
right, yeah.
Things. Is there anything else that you wanted to talk about real quick before we finish?
I guess maybe you could just give a few tips on personal statement. How should we go about writing it? How should we formulate our thoughts into words? And yeah, how
Yeah.
to create like a really good personal statement when we're
Yeah. So the best thing I can suggest, and this was actually an idea from a friend of mine who was also a pre-dental student at the time where I went for undergrad.
yes.
She said, honestly, just take a blank Word doc and just bullet point everything that you think would be a good thing to mention in a personal statement regarding your own experience. So, like
Okay.
you said, you were in that dental bridge brigade organization, so you'd write a bullet point about that.
Right.
You'd write about the paper airplanes thing you were involved in for people. You'd write a bullet point about that. You keep going down the document, just keep bullet pointing until you have a good amount, right?
Okay.
Then under each bullet point, write about 2 to 4 sentences, not just what it was, but what you gained from it.
Okay.
Because when we write personal statements, we end up summarizing what we went through, right?
Right.
But the most important thing that people forget in a personal statement is reflection upon what that experience enabled them to gain in the process. Like what did you take away from it that made you a better person? Stuff like that.
Okay.
So if you have, like, let's say, a paragraph where you're explaining something in your actual personal statement, I don't want the entire paragraph to be what did you do. I honestly want like a third of it to be what it was and what did you do, and then 2/3 of it being what did you gain from it, what did you learn, and what made you better. Does that make
Okay.
sense?
Yes, that makes sense.
Okay, perfect. So, just kind of go through that bullet point and write those sentences, and that'll give you a good skeleton in terms of how your personal statement could look like if you pick a certain amount of the bullet points to put into your personal statement.
Yeah. I think this
So
sounds
that's good.
pretty good because it'll allow us to organize our thoughts. And in fact, this is the first time that I'm hearing about this personal statement planning method. So I think it'll be
Yeah.
really helpful. Yeah.
Yeah, cool. And hopefully it'll work out for you. You'll be surprised how quickly you'll be able to just, get a personal statement going if you do this. It'll really help you a lot. And I'll actually probably make a video and kind of explain that too. So that's the second video I have in the works now. So the first one is interview questions,
Yeah.
and the second one's going to be how to tailor a personal statement. And yeah, I'm glad that we were able to sit down and hopefully you took something out of it, and hopefully people watching can too. So thank you again, Priya, for being part of One Mission DMD podcast series, and have a good day and best of luck on your pre-dental journey.
Thank you. Thank you for having me. I really appreciate it.
Of course, take care.
Thank you.